year, millions of Ugandans visit health facilities, while some opt for self-medication using drugs like paracetamol, commonly known as Panadol, Septrin, and diclofenac, among others. Unfortunately, some patients have suffered or died as a result of prescription drug effects. And unknown numbers suffer the ill effects of prescription and medications annually without being under the watchful eyes of medical professionals. This has risen out of a growing culture of people believing that they have a tablet or two as the safest way to reduce pain, yet some drugs react differently to certain blood groups. This to the Acting Pharmacological Vigilance Center head, Victoria Nambasa, warns that misuse of drugs like Panadol has contributed to high asthma, liver, lungs and kidney problems.
If somebody takes an overdose of paracetamol, they could injure their liver.
Ronald Chiguba is a local pharmacist who notes that even when the drug is dispensed by medics and taken according to instructions, usage has to be limited.
Every drug is actually a poison, and we need to alert the public about this. Drugs are poisons, especially if used inappropriately.
However, Professor Nelson Sewankambo explains that such interruptions do not only happen with painkillers like Panadol, but all other drugs. He says the situation could worsen when a patient complements modern drugs with local herbs.
The dosages for traditional medicine are not well established, and people take different doses depending on number of situations. And also, we don't know how the interaction between the two do work. Sometimes you may find that combining those two actually produces a number of side effects which are harmful to the patient.
Though drugs can be harmful when exposed to unfavorable conditions, experts also point to medical errors.
Quinine, where patients at one point were mismanaged, I would say, by some unprofessionals. They would give quinine injections on the buttocks without even diluting, and the children, we had some cases where children actually became disabled because of that.
Unfortunately, government is not fully equipped to screen all patients for drugs that could be harmful to their bodies.
In Uganda, we don't have these centers, but there are tests for developed world. In the developed world, there are some tests that you could, especially for hypersensitivity.
To address the hindrances, National Drug Authority has set up 13 centers at all referral hospitals to register claims on drug effects. Victoria Nambasa notes that these centers are mandated to ensure safety of all drugs on the market. Makerere University College of Health Services has embarked on investing in clinical trials to determine the drug side effects, to influence policy and ensure that only drugs with greater benefit than dangers are approved. Zahara Namuli, NBS, Live at 9.